Good morning and welcome to our Ask the Experts. We're talking, today is National Healthcare Decisions Day, so thanks for being here. My name is Kim Crable. I'm one of Hospice of Southern Maine's two community liaisons.
And I'm Kimberly Mann, the other. Welcome.
And we are going to share a PowerPoint presentation with you, and we're also recording this so we can put it on our Ask the Experts website.
And we'll take questions at the end, so you can type them in the chat. And we have a few that were submitted that we'll answer as well. We're gonna go right into our presentation now and share the screen, so hang on one second. All right. And what is National Healthcare Decisions Day anyway?
Well, it's sometimes referred to as NHDD, although I had never heard that until we were researching this.
Likewise.
And it's an annual initiative celebrated on April 16th. I think after you send in your taxes,
Right.
They want you to think about your future. And it's meant to encourage and empower people to begin or continue conversations about their wishes for care through end of life. And we're here to discuss how to start this and why. If you're one of the 2 out of 3 people who doesn't have any type of living will or advance directive, we're going to talk about why this is important.
Great.
So what is advanced care planning? Advanced care planning is a predetermined choice for healthcare when a person can't make decisions themselves. It's important to remember that as long as you're capable of making decisions for yourself, your healthcare provider will consult you. But when you're unable to speak for yourself, your healthcare provider will discuss your care with your agent, also called your healthcare power of attorney. Having selected an agent or healthcare power of attorney, discussing your wishes with them and having it written down in a document like Maine's Healthcare Advanced Directive Form, a living will, or another program. There are quite a few out there. There's a program called 5 Wishes that people might be familiar with. But writing it down like this assures that your wishes have the best chance of being followed. Will they always be followed? Not always. It depends on the circumstance where you're entering the hospital or what's happening, but the chances rise to 60% that they will be followed if you have them written down. It's one thing to write them down. It's another thing to make sure that people can find them. And I think sometimes that's part of that 60%.
That's true.
Most of us will die after living with a chronic, and well, I'm talking about the importance of advanced care planning. Most of us will die after living with a chronic and progressive illness. 80% of deaths will occur under the care of healthcare professionals. Up to 50% of people cannot make their own decisions when they're near death, and 50% is a very big number. Health professionals typically treat when they're unsure of the patient's wishes. So when it's unclear what the patient wants, they'll treat. Loved ones often don't know what the person's wishes are. And typically, sometimes I've heard horrible stories about them guessing incorrectly. Documentation can make all the difference. We believe that advanced care planning is important for everyone since accidents and sudden illnesses happen all the time, and by their very nature, they're unpredictable. We recommend that everyone 18 and older have an advanced directive.
And it's really not hard, right? So there are a lot of benefits. We'll outline a little bit of the benefits for you. When I did, the best benefit was the really, wow, it's done. You're so excited. Because it's like starting your taxes. Feels like something that's really overwhelming, and then you're done and like, ooh, that really wasn't so bad, right?
Exactly.
Although your taxes might be harder than this. A major benefit is that the patient's autonomy is honored throughout their life journey, so all the way through, even at the stage when they might not be able to speak or articulate or advocate for themselves. There can be improvement in symptoms of depression. There's an increase in the patient belief that their physician understands their preferences and cares about their choices. People are better prepared for the death and dying process, and loved ones can be an advocate for the individual and help them achieve end-of-life wishes and goals.
So successful advanced care planning is having your first document done and having a calendar reminder to review it and specific intervals so that when things change, you can update it. And we'll talk about that a little bit later.
Barriers to the process.
So from we're just gonna talk about two types of barriers. One is from the healthcare provider's perspective, and the other is from the patient or our own perspectives. Barriers to the process from the healthcare provider's perspective includes lack of time to sit down and have meaningful conversations with patients during their routine visits, which we all know how rushed those visits can seem. And then having this kind of paperwork to go through, which is you're making some very important decisions for yourself, some thoughtful decisions, and hopefully someone would like to have a conversation with you rather than just look at the form and say, yes, you've checked off the boxes. I think we all know that when we go into the physician's office now or into the hospital, they'll ask us if we've done our advanced directives. And if we have, there's no discussion around that. It's just something that you have to put in the EMR that they check off. My physician has never asked me to review my advanced directives, but once you're Medicare age, I'm not sure about other insurances, but Medicare will pay for a conversation, a routine visit conversation just to talk about these. So for anyone who is watching this, who is of Medicare age, you can call your primary care physician and say you'd like to schedule an appointment to review your advanced directives, and they will honor that. So it's hard to squeeze it in those short visits that we have. Some physicians are not very comfortable with this conversation. They're humans too, and it's a difficult conversation. So, and they're trained to cure people, and it can be a difficult conversation. And there are other things along the way, but those are kind of primarily some of the biggest barriers that we feel come from the healthcare provider's perspective.
And from the patient's perspective, the primary barrier is that it's uncomfortable to think about the situation when we can't make decisions for ourselves. And so we tend to procrastinate making these decisions or having those conversations. Some patients don't have anyone they feel comfortable enough with to name them as their agent. Some younger patients don't feel like it's necessary to think about this until they're older. They're going to live forever, certainly. And there are a lot of reasons, but for those of you joining us today, you've taken the first step, you know how important it is, and so thank you for being here.
So let's go forward and talk about the Maine Healthcare Advanced Directive form. So we're lucky in Maine that we have this form. It's easy to understand, easy to complete. It isn't quite as thorough as some other forms that you may be familiar with. For example, the 5 wishes, which asks a lot more questions and I think is a wonderful thing to complete and to share with your family. You can also share it with your healthcare provider, but the Maine Healthcare Advanced Directive form should be something that kind of distills what you put in these other forms and makes it more accessible to our healthcare providers. The form is broken into 7 parts, and we're going to talk briefly about each one. It is important to know that this form is really a living, breathing document. It's not something carved in stone. One of the things that we like about it is that on the first page of the form, it says you can cross out any words, sentences, or paragraphs that you don't want or don't agree with. Advanced care planning isn't cookie cutter, and even the same person, as your ideas change because you've learned some new ideas or you've been subject to different experiences or your healthcare situation changes, you might feel differently about this as you move through your healthcare continuum. There's no right or wrong. There's simply writing it down and sharing the information. And prior to writing it down or after you write it down, there is the sharing of the information, which is probably the most important thing, is making sure that people understand this information. Maybe you'll feel the same way today that you may feel if you become terminally ill, maybe not. People's ideas about what makes life worth living changes from when they're a healthy young individual and are capable of doing everything to when they're older and a little less capable. Like there's a continuum there. It's something that you may look at as a younger person and say, if that happened to me, I would not want to be kept alive. But some people, you feel differently. So
and change in status. Maybe you're married, maybe you're not, maybe you're in a significant relationship, maybe you have children, maybe you've got more children. All of those sort of life changes can prompt you to want to have this document and then to make updates regularly.
for sure.
Going on?
Yeah, let's move ahead.
All right, so part one is choosing a healthcare agent. Your healthcare agent is someone who's going to make the big healthcare decisions on your behalf when you aren't able to. And with all this responsibility, who should you choose to be your healthcare agent? In fact, we could take a quick second this was one of the questions that came in with the registration, was asking about what is a healthcare agent, what is an advocate? And it's simply this person that we're talking about. Someone who can, if you're unable to speak or you're unable to talk, if you have a memory care issue, so dementia or Alzheimer's, someone who can be your advocate, who can make sure that the healthcare system is following this document that you already set up with your wishes. And then if there are questions, they know you well enough to be able to answer things that maybe aren't answered.
And this isn't necessarily the first person you would imagine, like if you're married, it might not be your spouse.
Right.
It might be a friend, a relative, or someone else, someone who will advocate for you, is concerned enough about you, but not overcome with emotion in the process. There are husbands and wives who would not be able to do that just because the situation your health would put them in. Some people use the same person as the executor of their will, but it can be two entirely different people. I would look for the skills that match the job, and it's someone who can navigate and advocate and feels comfortable having those tough decisions when the time comes, and knows you well enough, or you've had lengthy enough conversations that they're very familiar with what your wishes would be.
Yeah, and we're gonna talk a little bit about what should they consider. We said this shouldn't be a family member. Did you want to go through some of these points too?
Yeah, so your agent will abide by the decisions that you've made on this advance directive form. For some people, you don't have to choose for everything that we're gonna go through. You don't have to choose one or the other. You can just say, I trust them enough. When the time comes and I can't speak for myself,
Right.
I'm going to allow them to speak for me. And some of the decisions are going to be, it's gonna be making all the healthcare decisions for you, including decisions regarding tests, surgery, medication,
Breathing assistance.
breathing assistance, feeding assistance, if you need food or fluids given to you by IV or through a feeding tube. Choosing where you would get your health care, such as a hospital or a nursing home, assisted living setting.
And in our case, hopefully someone who's informed and knowledgeable about hospice, so that they can advocate for hospice services to come on as soon as they're available to come on.
So this is a person, I think you get the idea, this is a person who you want to have long conversations with, to update on what you want, and that you trust that they're emotionally and just capable of doing it when the time comes. Hopefully you'll never need them, but if you
That's
do,
right.
you want them to be a good advocate for
And we like to point out as well that there's a spot on this form for you to put who you absolutely don't want. So if there are people you really feel like might rise, step up and say, I can do this, and you know that it's probably not the best person, you can write their name down as someone you'd prefer not to have that
you.
position. There's a spot for that. If the court needs to make a decision about your personal care, such as healthcare, where you live and how your personal needs will be met, you may opt to nominate your agent to be a guardian or select someone else as well. We talked about saying who you don't want. We talked about selecting a primary agent for your form. Some states want a list of relatives, some don't allow a certain, right? And then sometimes those aren't the best people to serve as your agent. So good thing to remember, Maine's form is really simple to use. It allows you to choose whether your agent makes decisions only when you're not able to or immediately. And that's something we hear a lot when we do these classes, is stories about making sure that that distinction is made.
Yep. All right, well, let's talk about part 2 of the form. So part 2 really is kind of the meat of the matter. and where you need to really be thinking about the decisions that you want and what kind of healthcare you want, should you be incapable of talking for yourself. So this is the meat of the matter that you need to talk with your agent about. And the biggest one is choosing not to be kept alive or choosing to be kept alive. And this is if you're in an unconscious or permanently vegetative state, what do you want? You know, do you want everything to be done to keep you in that state? Or is that the state that you yourself think life is not worth living and you would rather be removed from any medical supports?
You also, as part of life sustaining treatments, this is for Alzheimer's, so you may also want to make the same decision for memory care issues, like Alzheimer's or dementia. And then also artificial nutrition and hydration. Do you want to choose to allow for that or not allow for that?
And remember, this is only when you have a terminal illness, are in a persistent vegetative state, or have late stage Alzheimer's or severe dementia, or some other reason that you cannot communicate and you are in need of artificial support in the hospital.
And we just want to remind you, it's your choice. So when you make these decisions ahead, you get to be the person in charge.
In part 2, it talks about relief from pain. And your choice is, I want treatment for relief of pain or discomfort to be given at all times, even if it makes me drowsy, unconscious, or unable to do other things. So this is, you know, you can either check this off or not. You can make your own decision about your relief, and sometimes when you do have medications given to you, it does affect your cognition, but at this point, if someone else is making these decisions for you, then your cognition has been affected severely already. So just something to think about.
And other directions, you can provide guidance to your healthcare agent on any other issues that you may be concerned about. And this is where it's really individual. Everybody's health is different. Everybody has different things going on, different sensitivities, different preferences for settings. And this is where you can write in anything and make it very personal about you, or you can just keep it very basic, high level, and a point agent. Like the range is there. And we like to say, like, just start it. If the only thing you can do now is get it filled out and signed, that's great. And then if you can go back in a year when you set that calendar reminder and fill in some of the things, so it's like a step-by-step process, then add in something else. You can do that. Just get started.
Part 3 is where you indicate your primary physician. You just provide your primary care physician and the information that you want your agent to discuss with your healthcare, about your healthcare needs with this person.
Yeah, and it allows them to have those conversations.
Exactly.
We get questions about donations. Part 4, this is what do you want to do and for what purposes? So things to think about. If you are going to make any kind of donation at end of life, contact a medical school before donating your body to research. There are availability issues. Certain schools have kind of rules that they follow and timelines and guidance. So anything that you might choose to do like that, look into it ahead of time, get phone numbers, get documents, and keep those with these pieces of paper.
And that goes for organ donation as well. That's a little bit different, but if you are planning on donating your body to science or to research, then like Kimberly said, you do need to contact the organization that you do want to do a donation to and understand what their acceptance policies are. And also just be aware that it may be 1 or 2 years, or 1 or more years, I should say, before your remains are returned to your family. So we have heard from some people that it's very difficult to navigate that time period if your waiting to say goodbye to your loved ones and you don't have, any ashes to scatter. So that is just a consideration to think about, because if you do donate yourself, they may not need you right away. They might need you for next year. So people might be in a state of, suspension for a short time.
That's true. Parts 5 through 7. Funeral and burial arrangements can be noted on the form, so you can direct the reader to other forms, other documents, include phone numbers, contact information. And signing, you need 2 witnesses, but it doesn't have to be notarized. However, we do encourage it.
If you're one of the Mainers who travels out of state part of the year, or even if you travel at all, it's smart to take this with you and to have it notarized at a bank or somewhere that's easy to have that done. Other states have different rules about having it notarized, so we just encourage that if you are a traveler at all, you do have it notarized. And part 7 is instructions to the EMS, and it's the do not resuscitate decision. And that is something that, you have basically decided that if you stop breathing or your heart stops, if you have a DNR, you don't want emergency medical services to resuscitate or revive you. And that is typically something that, people, I haven't met anyone who doesn't have a strong opinion about one way or the other about that. So that's something that you would need to think about and talk with your agent about as well.
I don't know if you want to show that.
Yeah, we can show this. In Maine, in some areas, we have what we call a yellow dot program. And it's basically if you filled out your DNR, making sure that people have it accessible. And I know mostly when people have it at home, you'll give it to your physician, you'll give it to the hospital when you go in. People typically have it at home somewhere. It's good to make a note of where that is at home. Some people have their DNR on their refrigerator. EMS groups, when they come in, they typically look on your refrigerator or in your refrigerator, because some people keep them in their refrigerator just as someplace that's really accessible. If you're driving, you can use the yellow dot program, which you just have, there's a little sticker in here, the yellow dot, you put it in the back window of your car, and it indicates if you do get in an accident or something happens while you're driving, it indicates to EMS and to the police that you do have a copy of your medical wishes or your DNR in your glove compartment. So there's information that you can fill out here, but we encourage, if people are going to do this, that they also keep a copy of their DNR.
Yeah, it's a nice little program.
Yeah. So when should you revisit? We've talked a little bit about revisiting this, and this is from the American Bar Association. And as the saying goes, the one certainty in life is that things will change. We all wear different hats and have different roles to play in our life as time goes on, and things do change. And these are the 5 Ds that the ABA says when to revisit your advance directive. And the first one is the death of a loved one. And I think that's because your idea around death may change at that point, and what you want might change. But the other thing is this person may be named somehow in your advance directives. They may be your agent. So they want you to take it out and look at it, make sure you still agree with it, make sure there's nothing that you want changed. If you do change it, you can either create a whole new form, or you can just make a change, cross out something, initial it, put the date. Make sure that you send copies to everyone who has a copy of your original form. The second thing is diagnosis. If you get a severe diagnosis that you have some kind of life-limiting illness, this is certainly a time to take it out and revisit what your thoughts are on this.
Decade, I suppose if you're doing this young enough, we can every decade or so change things.
Yes, yeah, they want you to think about it every decade.
I mean, we might encourage you to do it a little sooner if you're starting it later, like some of us have.
Right, but if you're 18 and you have it,
Yeah.
Probably 28 is a good time. And if you have a decline in your health, like if something has happened that your health has declined in some way, it's a good thing to have that be a reason to take it out and just look at it. And once you've done it, reviewing it isn't going to take you very long. It's just to make sure that it's still.
That's right. And certainly legal changes in family relations, such as divorce, it's a good time to revisit all of the paperwork, advocacy issues, so that's a good time as well.
For sure.
And do you want to tell your example or story?
Yeah, we're running.
All right, we'll move right on. And guess what? You're done. I know it sort of seems like it must be harder than this, but it really isn't. It's when you print out the form, it's very straightforward. It walks you through it. It's self-explanatory. There are good directions. And there are a lot of people who know or can answer questions when you're doing it. So.
And there are a lot of, we've talked a little bit about 5 wishes. There are a lot of resources online that you can go and just review what some of these decisions, like not having artificial nutrition or hydration, what that actually might mean and what circumstances you might find yourself in to arrive on that. So you can do pre-work, like we all do, we Google everything. You can do some pre-work and say, okay, what does that mean? And then fill out the advanced directive form, because like we said, the advanced directive form is pretty cut and dry. Its purpose is to make it easy for when someone's in this situation that someone has to react quickly, that there's not pages and pages of reading. So it tries to cover a lot of circumstances in one document. So just be aware of that. It might, if you're here with us today, it might just behoove you to spend a little time. There are a lot of books at the library you can take out to kind of walk you through it and what these decisions mean, but the end point is getting the paperwork done, like Kimberly
And
said.
start by having the conversation and sit down with your family members, encourage other family members to start and do their paperwork as well. If you have children that are of adult age now, they should be doing this as well. Maybe you could all do it. So I think it's a good thing to start. It's not so hard, and there are a lot of good resources. In the chat in this webinar, we posted the link to the maine.gov website where you can find the form and print it out for yourself, as well as they have other resources available on that website. So what do we have here for
I think we answered all of our questions.
Yeah, I think we have. If you have anything else you'd like to throw in the chat, feel free to do that now. And we like to say, as far as other kinds of advanced care planning for these healthcare issues, don't forget you have a million passwords out there, and some of your access to like your MyCharts and other forms might be on a phone. Make sure that you've stored passwords in a good place. A lot of EMS responders, when they go into a home, will look on the side of a refrigerator. That's a common storage place to have a copy of these forms. Like we said, in your car glove box is another good place. Certainly with your advocate and at your doctor's office or specialist's office.
And there are a lot of digital places that you can also store them and give people access. You certainly would want your agent to have access and maybe some people in your family. So there are digital resources you can use. Some are very inexpensive.
And remember, if you have it stored digitally through your computer and your loved ones don't have your password, that can be a problem. So make sure that you've provided access to passwords. All right. You'll see that this recording, once we've uploaded it to our website, will be part of our library for Ask the Experts. So you can find other resources there too. We have a pretty good set of videos that you can watch on various end-of-life topics. And we encourage you to watch them, to share with others, and to learn what you can about this important topic and other important topics as well. Have a great day.
Thanks for joining
Enjoy the
us.
sunshine.